Rheumatoid arthritis is a chronic inflammatory disorder that primarily affects the joint. Unlike osteoarthritis, which is caused by wear and tear on the joint, rheumatoid arthritis is an autoimmune condition. The body's immune system mistakenly attacks its tissue, particularly the synovium. These persistent inflammations not only affect the joint, but can also damage other parts of the body, including the heart, lungs, and blood vessels. Rheumatoid arthritis symptoms vary among individuals, but commonly include joint pain, stiffness, and swelling. The joints most often affected are those in hands, wrists, feet, and knees. Morning stiffness lasting for hours is a hallmark feature. Apart from joint-related issues, systematic symptoms such as fatigue, fever, and weight loss can also occur. In severe cases, joint deformity and disability may result. The precise cause of rheumatoid arthritis remains unclear, but it's believed to result from combinations of genetic and environmental factors. Certain genes predispose individuals to develop rheumatoid arthritis, but environmental triggers like infections or smoking can also play a role in its onset. When the immune system gets activated by these factors, it mistakenly attacks healthy joint tissue, leading to chronic inflammations and damages. Clinical practice guideline for physical therapist management of people with rheumatoid arthritis. In this section about following non-exercise therapeutic intervention, it said that passive mobilization of joints and muscles should preferably not be offered to patients with rheumatoid arthritis. Consider short-term passive mobilization of an affected joint to support exercise therapy only to patients without active inflammation to increase joint mobility. This is a conditional recommendations, neither in favor nor against the intervention, lack of evidence, and also passive mobilization are contraindicated for cervical problems, strong recommendations against intervention, but still lack of evidence. You should aim that the patient preferably perform daily, but at least 2 days per week for a muscle strengthening and functional exercise, to at least 5 days per week for minimum 30 minutes at a time for aerobic exercise. In intensity, for muscle strength training, it should be something between 60 to 80% of 1 repetition maximum or 50 to 60% of 1 repetition maximum for people not accustomed to strength training. And in aerobic training, it should be something more than 60% of maximum heart rate or 40 to 60% of maximum heart rate for people not used to aerobic training. In a muscle strength training, you should choose exercise primarily aimed at a large muscle group around the knee and hip joint, especially knee extensor flexor and hip abductors. Have this exercise performed on both legs and be aware that exercise with high mechanical knee load, like leg extension device, should preferably be avoided in a case of knee osteoarthritis and after joint replacement surgery of the knee.